No matter your age, when it comes to your health, mobility, and being pain-free, it's of the utmost importance, and chronic injuries can easily happen when we're talking about the hand, wrist, and the elbow area right here. We're on your side with Dr. Davis Rogers. He's an orthopedic surgeon with the Alabama Bone and Joint Clinic. How are you doing?
I'm doing very well. Thanks for having me.
So what type of issues are we talking about if we have injuries from anywhere from here to there?
Yeah, absolutely. So, my focus is really on the upper extremity and probably more selectively the elbow through the hand and wrist.
Right.
And there's a wide breadth of injuries that can happen. These can be chronic injuries like arthritis or tendinitis. And they can also be acute injuries like lacerations of the hand or fractures as well. And I think, all of that is included in what I'm looking to do. I'll see problems all over the body as well,
right.
Having a general orthopedic background, but as I move on, I'll try to kind of focus on the upper extremity.
Well, some of the things that you were talking about aren't necessarily instant injuries. They might have been something that you've been dealing with for a while. When should people at home say, I need to go see an orthopedic?
Yeah, I think that's a great question. And it's one of the things I love about hand surgery. I feel like everybody, no matter what their job is, it really relies on using their hands. And even at home, if it's interacting with their kids or just doing their activities of daily living. And so it's very frequent and common for people to have hand injuries, even if they're chronic. And so on the flip side, it's kind of like a double-edged sword. I feel like because people need their hands so much, they really don't want to take that step to go to see the doctor sometimes because they don't want to lose their hand function. If I could offer any encouragement, it would be like if you do have, painful areas, you're having difficulty using your hand, you've got any lumps or bumps that you want to get evaluated, we have so many options that are outside even surgery that we can help you kind of return back to what you're looking for.
Do you need a referral from your primary care physician to go see an orthopedic surgeon, or how does that usually work?
I think sometimes it depends on the system.
Okay.
Usually I think the easiest way is to get a referral, but I know our clinic is working on establishing an ease of access so that people can get in even without a referral.
Yeah, you are about surgery and repairing, but do you always try to see if you can fix it or repair something without that process, or what?
Absolutely. I feel like calling myself a hand surgeon is a bit of a misnomer.
Right,
because I feel like, if anything, I'm a hand clinician. And my goal is to do the easiest and safest path to get you back towards the function that you're looking for. And we have a variety of bracing. We can do injection. We can do hand therapy. There's all these options that we have before we get to surgery. So I really try to maximize those before we make that leap.
Yeah. Are you into the robotics, or has that reached that
No,
type of
robotics
area?
has not quite reached hand surgery.
Okay, good. Yeah, no. Where is Alabama Bone and Joint Clinic?
Yeah, it's located in Pelham. It's kind of at the northeast corner, of the Hoover and Pelham Junction, right in that area.
Go visit you, and then the Harley Davidson is just down the road, right?
Exactly.
There you go. Dr. Davis Rogers with the Alabama Bone and Joint Clinic. We appreciate it. Some good information right there.
Thank you.
And good luck. He's expecting his first child sometime later this week. Congratulations to your family.
I appreciate it.
Mick?